coming up as well, probably in our discussions, in our working group meetings. So thank you, Alex. Now I pass on the floor to a very dear colleague of mine, an expert in mental health. She has been, valuable in my professional career because she taught me so much in the past year about what we do as physios. I'm a physio, but obviously always glad to learn further on what our services can render and our profession can render. She is Dr. Cristina Bravo from Spain. A colleague physiotherapist who is an expert member on our mental health working group, a tireless member, may I comment, of the European region of World Physiotherapy. She lectures and researches at the University of Jeddah and a member of the research group in health belonging to the Jeddah, who has also a foundation that focuses on research. She's the Vice Dean of the Spanish Association of Physiotherapy and Mental Health in Spain. Cristina, the floor is yours. Thank you very much.
Thank you very much, Maria, and good afternoon to all. I'm Cristina Bravo, and it's an honor to be here and to have the opportunity to address you in this European Parliament for Mental Health Day. I'm working in the mental health group of European region of World Physiotherapy, and I want to talk about the perspective of physiotherapy in mental health. Thank you. The purpose of that talk is providing an outline of the role of physiotherapy in mental health service across the European region. Here, there are my colleagues from working group around the European countries. As Sir Marie said, we are leading for Maria Busutil and Katri Partanen. Next. Okay, to start, I would like to provide the definition of physiotherapy in mental health to understand the role and the function that can be covered by the physiotherapists in mental health. Physiotherapy is the art and a science of applying physical agents for the promotion of individual overall health, prevention and treatment of mild, moderate and severe mental health conditions, as well as acute or chronic conditions and rehabilitation of their consequences. Physiotherapy also in mental health is person-centered and provides for children, adolescents, adults, and older people. Physiotherapy are present in primary and community care in patients and outpatients. The special theme or speciality is to create a therapeutic relationships to provide assessment and service specifically related to the complexity of patients with mental health for playing a model including biological and psychosocial aspects. Also, physiotherapy in mental health contribute the multidisciplinary team and the interprofessional care based on the available scientific and best practical evidence. Thank you. The main aim or specialty is optimize well-being and empower the individual by promoting functional movement awareness, physical activity, and exercise, bringing physical and mental aspects. Also, not only that tools we use, also in order to establish effective therapeutic relationships, we use relation factors and group therapeutic factors. We can work individual and in groups with our patients, and these tools are essential for the treatment of our patients. Okay, physiotherapy is the bridge between physiotherapy and mental health, is a bridge between somatic or physical health and mental health. The latest evidence in neuroscience shows that chronic conditions are related with mental health states. And it is important to have the global view of our patients and not only physical aspect, not only mental aspects, it's a whole individual, and we treat whole the individual. What's more, physiotherapy, implementation in physiotherapy, mental health has a long and a strong tradition for more than 50 years in education and clinical practice. The first region that developed physiotherapy and mental health was Scandinavian countries. And thanks to the influence of philosophers and psychoanalysts such as Wilhelm Reich. There is no health without mental health. That was the slogan, the last slogan of our last International Congress. And the mental health is an integral part of the health, and the physical and mental health are intertwined. For example, when you have a problem of physical issues, like breaks a foot and has to rest for a month, your daily life stops, and maybe you can feel anxiety and depressions. On the other hand, when you are depressed, you have a specific posture. Is studied scientifically. Your posture is shoulders and head forward sometimes, and you have less activity, which can affect your musculoskeletal system also. Thanks. In this slide, you can see an image. It's in Spanish, but I translate. The first two says medication and surgery, and when the other window says lifestyle changes. Yes, physical activity shows as the best non-pharmacological intervention in several conditions. A sedentary and inactive lifestyle is one of the major issues regarding mental health. There are significant associations between amounts of sedentary behaviors and increased psychological ill-being, as a depression, or lower psychological well-being, as a satisfaction for life and happiness, almost or even in children and adolescents. Lifestyle change and self-care are our priorities as a physiotherapist through the patient empowerment. This is important for us. Thank you. Why is physiotherapy relevant in mental health? Physiotherapy in mental health is an emerging field within the professional to address the current healthcare needs of society, especially in the aftermath of the recent pandemic, as our colleagues explained before. Also, it is a specialized area of physiotherapy that relies on scientific evidence derived for practical clinical interventions are thoroughly reviewed and evaluated based on scientific criteria. Our role are integrated as a part of multidisciplinary team, which includes psychologists, psychiatrists, nurses, occupational therapists, and others. It is important because we have only one piece of the cake, and it's important to collaborate with other professionals because there are a big complexity of our patients, and it's important that our colleagues know how we work and how we work the other colleagues from the multidisciplinary teams. And the last one is professional development. It's crucial to define the responsibilities and the competence of physiotherapists in this specialization carefully. It's important to, in order to integrate our specialty in the multidisciplinary team. Okay, that slide explains an example of our proposal for the European Commission. We have submitted a strategic proposal to the European Commission to promote physical activity and education for the prevention and treatment of depression in adolescents. As Alex says, it's very pandemic problem, the suicide and the depression of adolescents. And there is substantial evidence supporting the use of physical activity in depression treatment. To incorporate physical activity on their daily lives could improve substantially the symptoms of depression and can be part of their self-care. This is a key point, important point, because it's important that the people have managed their symptoms, and we can help to motivate with motivation strategies and other tools for them. Okay. That slide explains another project from the European region of physiotherapy. In physiotherapy. This project aims to promote physical activity in older individuals through the smartphone technology. It has been successfully implemented in Italy and in Spain, with a high level of acceptance among participants who appreciate both physical activity and the relationships through the implementation of this intervention. That intervention was conducted in a group setting supervised by physiotherapists. And now we can see the video.
Io sono Lola Valginigli e sono una pensionata attiva nel sindacato pensionati della CGIL. Il mio ruolo nel progetto Enable City come figura ponte è quello di promuovere l'attività sul territorio insieme al comune e al quartiere Savena, dove si svolge la sperimentazione. Sono una figura ponte tra il comune e la società civile per promuovere, anche per trasmettere, comunicare, veicolare anche delle informazioni corrette sulla salute e il benessere delle persone. L'app è molto semplice e ha dei contenuti anche scritti, ma con una narrazione molto amichevole. Partiamo. Quelli sul posto giochiamo avanti. È bello stare in gruppo perché poi fra di noi ci aiutiamo con l'app. Queste piccole innovazioni vanno considerate come medicina di territorio.
Sono Alvise Saccon, kinesiologo. Mi è molto interessato il progetto perché è una sfida per diffondere l'attività fisica negli anziani attraverso un'app, perché è un progetto innovativo e inoltre prevede lo svolgimento delle attività outdoor, che è importante per il benessere degli utenti a cui quest'app si rivolge. Il mio ruolo in quanto Physical Activity Manager è stato quello di gestire attività fisica di gruppo di circa un'ora e di portare i partecipanti all'utilizzo dell'app in modo tale da a fine progetto essere autonomi e praticare attività da soli con l'utilizzo del telefono. Nel corso della sperimentazione i progressi principali sono stati quelli nelle capacità di equilibrio e di coordinazione, nella propositività e nel senso di comunità che i partecipanti hanno provato nelle attività e soprattutto anche nell'utilizzo dell'app e nell'utilizzo dello smartphone. Ritengo che la partecipazione a questo progetto sia una grande opportunità per i partecipanti perché avere un'applicazione che hanno sempre a portata di mano da utilizzare per eseguire l'attività fisica a casa o all'esterno o in gruppo è utile sia per gli anziani, persone con disabilità oggi, ma anche per i futuri anziani che saranno molto più abituati a utilizzare lo smartphone.
Io sono Pietro e sono la figura ponte di questo progetto che si svolge nel quartiere Navile del comune di Bologna. Il mio ruolo è quello di fare da tramite tra gli operatori iniziali che hanno organizzato il tutto e i gruppi che si sono costituiti dei vari quartieri, particolarmente quello a cui io faccio parte che è il Navile. Un'app molto facile e semplice da usare. Oggi gli anziani sono circondati da strumenti elettronici, informatici, si devono necessariamente adeguare. Per mantenersi giovani c'è necessità di sapersi muovere e in questo l'app va centrata in pieno, suggerendo i vari movimenti che bisogna fare per quanto riguarda un migliore tenore di vita, stare un pochettino meglio, non soltanto fisicamente ma anche con lo spirito, con le relazioni che comportano questi gruppi.
Sono Anna Maria Foggetti, sono una fisioterapista. Mi sono avvicinata a questo progetto perché è molto sensibile a tutti quei progetti che vanno nella direzione della prevenzione. Il mio ruolo è quello di PAM, che nell'acronimo è Project Activity Manager. È stato quello all'inizio di selezionare le persone per la formazione dei gruppi come appunto la sperimentazione prevedeva, e di condurre i gruppi durante l'attività e l'esercizio, di cercare di supervisionare le modalità di esecuzione dell'esercizio per far sì che i partecipanti potessero svolgere gli esercizi in sicurezza attraverso momenti di formazione avviati all'interno di ciascuna seduta. Abbiamo riscontrato nella maggior parte dei partecipanti un buon esito nell'utilizzo dell'app. Ho osservato notevoli miglioramenti nella maggior parte dei partecipanti, che hanno migliorato la loro postura, hanno migliorato il loro senso dell'equilibrio, quindi insomma anche il loro modo di apprendere ed eseguire l'esercizio fisico.
Okay, and it's important, as a patient or person says, that the functional strategies in physical activity and in the relationships with the group is very important to take contact with that strategy. Okay. Okay, now we changed the presentation, and I want to explain about scientific evidence. As a researcher, it's my field of expertise. And in this slides, you can observe the amount of the increasing number of publications in scientific journals of mental health physiotherapy. This is a search I was done in May of this year, and I conducted a search on PubMed, combining physical therapy and physiotherapy with mental health. I found more than 21,000 articles published on date using physical therapy, and more than 6,000 articles using physiotherapy. If we limit the search to the last 10 years, we find more than 5,000 articles. Out of these, 1,000 are randomized clinical trials, and more than 700 are systematic reviews and meta-analysis. These explain the amount of interest in this field and advanced in the evidence. The research lines that generate the most interest and evidence are physical activity or therapeutic exercise and body awareness therapies. This kind of interventions has been assessed in several health conditions such as depression, anxiety, schizophrenia, eating disorders, and chronic pain. Thank you. Okay, this is a publication, the work of a colleague, Lidia Carballo, and she was conducted the most published topics among the 19 1,000 publications found. The main topics published in this field include physical activity and eating disorders and addictions. It's important, this field in the mental health is very, actually the growing in this patient, the number of these patients. Also, mental health in aging, chronic disease and cancer. Additionally, topics on exercise and neurological issues, chronic pain and severe mental disorders emerge with high intensity. Thank you. And you can, another, okay. There are many studies that evaluating the effectiveness of physical activity in mental health, but I would like to highlight this particular one as it analyzed the mechanisms through which exercise proves beneficial. In this article, the authors emphasize three mechanisms. The first is hedonic effect of exercise. Everyone, when you go walking by the mountain on another trip, you feel comfortable, you feel better, well-being, yes. And induce general physical well-being. They also discuss improvement in neurobiological mechanisms, enhancing neuroplasticity in the pathways of system neurological center. And lastly, they highlight the behavioral role of exercise, such as the sense of self-efficacy and the self-regulation of the patients. The exercise could improve the behavioral with the others and the group also. Thank you. Okay. Okay, through the effectiveness of physiotherapy and especially in mental health has been demonstrated in various chronic and acute health conditions that can be addressed through primary care. Physiotherapy have recently been included as a professional in the primary care system. Our specialty has some special characteristics that it develop agreed tools that we spend time with your patients, and we can be in contact with them. That is a very appreciated tool for creating a relationship that we can develop our biopsychosocial factors with our patients. For all that, we can establish the connection with our patients, and we can apply this approach in our interventions. Therefore, we consider it is important to include this specialty and assess the potential cost savings in socioeconomic terms that it will be entail. It's important to have time and contact with the patient. And also a stigma has been developed, another challenge of our patients. And for us, for physiotherapists, we don't have not so much stigma in our sessions like psychologists or psychiatrists for the other people. We think that our professional specialty don't have a special stigma of our patients. Yes, thank you. Multidisciplinary team, no? The mental health physiotherapy aims to enhance or alleviate the symptoms of mental disorders through the body function and functionality. Mental health issues are complex and require a multifaceted approach. Furthermore, the body also requires attention, and this is why it can provide great value in the treatment of chronic conditions through physical activity and body awareness therapies, among other techniques. The body is our issue, is our theme, and it's important to take attention with the body of our patients because they have a lot of comorbidities, and also most of the symptoms are reflected on the body, like attentions, changes in postural pattern, and something like this. It is important to take care of that. Yes. And for last, regarding challenges and opportunities, we think the most opportunity for us is to understand the role of the physiotherapy in mental health within the context of multidisciplinary team. We think we can help with a holistic view our patients, and we can help our multidisciplinary team to cope with the whole patients, not only the mental aspect, but the physical aspects too. Yes. The other challenge is adapting primary care to facilitate the integration of biopsychosocial care approach by the physiotherapists. We have time, we have contact, and we can develop treatments with this approach, and I think is very, very important. And that idea is in the line of WHO, that they want to implement holistic interviews and biopsychosocial approach in our patient, and especially mental health, because they are very complex. And this, implementing a holistic intervention that prioritizes person-centered care in primary care. Every patient is unique for us, and we can treat with their individuality. And we have a lot of tools to cope with them. And finally, thank you for your attention. And that is my email if you want something. Thank you very much.
Thank you, Christina. Well done for a very detailed presentation. We already have some comments coming in about the competencies of physiotherapists and what reflects in our basic education programs. Obviously, we need to, even our physiotherapy education programs reflect our population trends. As Mental Health Working Group, we are committed to present a paper on the actual core competencies of physiotherapists